In almost every hospital, real revenue that has already been earned is quietly lost. Six or more disconnected systems that don't talk to each other. Clinical data never reaches billing. Billing doesn't know what the insurer needs. And finance waits for month-end reports to discover what slipped away. Claims get denied, decisions get delayed, and the result is loss that was entirely avoidable. This is where Murmur3 begins. One system that follows the patient's journey from the very first step to the last. It brings the electronic medical record, inpatient wards, the lab, radiology, the ERP, the revenue cycle, human resources, and patient engagement into a single unified operating fabric. No silos, no re-entry. Care and revenue move side by side automatically. The secret is in the architecture. A single patient record is the beating heart that every module reads from and writes to in the same moment. What the doctor records, the accountant sees. What the lab orders appears in the chart instantly. No delay, no duplication, no information lost between one department and the next. One source of truth that everyone can trust. Clinical excellence begins with knowledge. With Murmur3, the doctor knows the patient before they even walk in. Vital signs aren't shown as static numbers, but as trends over time that reveal improvement or deterioration at a glance. Medications, allergies, diagnoses, results, and imaging, all on one organized screen. And the diagnosis is coded at its source, so billing reads it without re-entry. And here is where we truly lead. The patient's clinical story begins before they ever reach the front desk. They scan a QR code and complete an intelligent self-assessment on their phone. The AI scores the severity, escalates critical cases instantly, and hands the nurse a pre-sorted queue. The result? Wait times cut by more than half, and a doctor who opens a fully prepared chart. And we go further. Radiology reports no longer wait. Our local AI scribe listens as the radiologist reads the study, drafting a structured, coded, sign-off-ready report in real time. The radiologist reviews and signs instead of starting from a blank page. And most importantly, all of this intelligence runs inside the hospital's own walls. Your patient's images and data never leave the building. In the inpatient wards, every bed and every unit sits in one frame. Admission requests, bed allocation, available capacity, and patient flow appear moment by moment. Administrators and charge nurses work from the same board. No phone calls, no guesswork, and no bed left empty while a patient waits at the door. A smoother experience for the team and the patient alike. As for revenue, it follows care automatically. And here we surpass traditional systems. When documentation, coding, and billing run in one connected lane, the claim leaves the building clean and complete the first time. We target acceptance above 95% on first submission, eliminating rework cost, accelerating collection, and protecting revenue that used to leak away in silence. We know that most claims are denied for procedural reasons, not clinical ones. Missing documentation, a coding error, or an eligibility mismatch. So Murmur3 keeps compliance attached to the workflow at every step. Eligibility is verified at registration. The insurer's rules are applied before submission, and errors never survive to the moment of sending. Early prevention, 14 times cheaper than recovery. And for leadership, complete transparency in the moment. Every cost and every line of revenue, now, not at month end. The Finance Center syncs live with Odoo, so the executive sees revenue, costs, receivables, inventory, payroll, and claim exposure on a single screen. Decisions built on real-time truth, not on a report that arrives too late. And from punch-in to payslip, a fully closed loop. Attendance verified by location, with one device per employee that prevents buddy punching. Intelligent shift scheduling integrates with leave requests, closing gaps before they happen. And payroll cost flows directly into finance, so there are no surprises at the end of the month. An app in every employee's pocket, connecting them to their hospital. And at the heart of all of this, the patient themselves. They transform from a passive file that waits into an active partner in their own journey. A unified medical record follows them across every branch of the network with appointments and reminders that reduce no-shows. And the WhatsApp AI assistant lets them upload records, ask questions, and book appointments without installing any app. Care reaches them wherever they are. And this is not a promise, but documented proof. Every intelligent feature in Murmur 3 is grounded in published research and real results from hospitals operating today. Reductions in wait time, in documentation time, in duplicate tests, and in denial rates. Our AI doesn't decorate, it genuinely changes the outcome. Behind Murmur 3 stands Encilus, one of the most advanced companies in connected healthcare. We are engineering the next era of the hospital experience. Our vision is clear: deeper integration, smarter systems, intelligence that works inside the hospital rather than outside it, in data that stays sovereign within its walls. We are building today what tomorrow's hospitals will need. In the end, this is not just software. It is the operating system of the hospital. From the moment a patient arrives to the moment the last unit of revenue is collected, every department, every workflow, and every decision runs through one connected system: clinical, operational, financial, and human. Murmur 3 by Encilus. One hospital in one signal.